You're not doing too well. Well, I am here to help you. So you just sit there and relax, and I'm going to take care of you. You came in with some symptoms and some problems, so we're going to go over this. If you don't mind, I'm going to pull out my trusty clipboard here. The nurse has taken a little bit of information for me, so I'm going to look it over with you and talk to you about it. Then I'm going to gently check you out, okay? Yeah, you're going to be just fine, okay? I'm here to help you, and I'm going to take really good care of you, I promise. So I have my clipboard, and the nurse has taken some notes, so I'm going to take a peek at that if you don't mind, okay? So, okay. Yeah. Okay. Let me get my trusty pencil here. Now, you are not running a fever, so that's a good thing. So no fever. Your blood pressure was very well. So, okay. And so you're saying you're coughing and sneezing. Yeah. You have a little bit of headache. Where's your headache at? Okay, so your headache is located in this area. Okay. Runny nose. Okay. Coughing, sneezing, runny nose. And your throat is bothering you just a little bit. Okay, I'm going to take a look at that too. And your headache. Okay, I'll take a little peek at your eyes also. But I don't think it's anything major. But we're going to take a look, and we are going to take such very good care of you. I promise you this. Okay, so first, if you do not mind, I will put on some gloves so that way I can gently just touch around your face very gently so we can see where your pain is and if there's any problems. Then I'm going to look into your nose and your eyes and into your mouth so I can check out your throat and stuff like that, okay? Yeah, I'm going to be very gentle, and so you have nothing to worry about, okay? It's all going to be very gently done, and you're going to be very well taken care of. So I'm going to set this aside for a few minutes. I may have to come back and take some notes, but that's okay. That's common, okay? So we'll set that aside. And I always carry around a packet of gloves. I know that they're usually up on the wall, but I also carry some with me too, because sometimes I come into a room and I forgot to fill them, so I always carry a pack with me. I just keep them in this plastic container here. That way they are kept sanitized and taken care of. So if you do not mind, I would like to put a pair on so I could check you out. Is that okay? Yeah, you're not allergic to latex or anything? No? Okay. Sounds wonderful. So I will unsnap it. And I'll gently pull two out, 1 and 2. My hands are completely sanitized, so you do not have to worry about that whatsoever. I sanitize them before I come in and during and after, so don't worry. So I have my gloves out of here. I'm going to set this aside. So I always carry it with me just in case. And even when I'm not in the office, I always have some gloves with me. You never know when an emergency may arise, and I want to make sure I have gloves. So I have my gloves here. So I'm going to put them on, as you see, like so. Now I'll put the other one on. So I have my gloves securely on. Now, if you do not mind, I am going to gently press on your face. I'm just going to press gently around it and just see if there's any sensitive spots. So you let me know if I'm hurting you at any time, because I will stop. But I'm going to be so gentle, okay? Just going to gently, very gently just touch around. Am I hurting you at any point? No? Okay. Just gently. Okay. Very gently. Just very gently. Okay. So you really have no very tender areas, but you say you hurt and stuff like that. So what I'm going to do is, if you do not mind, I'm going to take my flashlight. It is very bright, as you see. Very bright. Very bright. So I have to look into your eyes. And so I'm going to take it and I'm going to gently look into your eyes like so. And then I'm going to have you move your eyes just so I can look in other areas back behind it, okay? So you see it's a bright light, so we're going to be very gentle. Are you ready? So let me just look into this eye right here. Okay. There you go. Let me just take a peek over here. Okay. Yes. It looks pretty good back behind the eye. So I do not see any kind of problems back there, which is a really good sign. I'm just checking because you said you have such a bad headache. But what I want you to do is this light here is I want you to follow it. Whichever way it goes, do not move your head, just move your eyes with it, okay? Okay, so here it is. You ready? Very gentle and very slow. I will move it back and forth and up and down. You just follow with your eyes. There you go. Right. Okay. Very good. Thank you for being so patient with me. Okay, yeah. Now just look up for me really quickly. Okay, so next, if you don't mind, I'm going to look inside your nose. I just want to see how it looks in there, and then I'm going to look inside your throat, and I'm also going to use a tongue depressor and check out the area back there. So I'm just going to look in your nose just very quickly. Okay, you look up. Okay, yeah, you have a lot of congestion in your nose and stuff like that. So I'm going to turn this off and I'm going to put it aside. I will definitely, I'm going to listen to your heart and your lungs also, but we'll do that towards the end. And then I'm going to show you why I was looking in your nose and stuff like that. So I have some tongue depressors here. What I'm going to do is I'm going to open this up. Just like so. I'm going to take one out. And so what I'm going to do is have you open your mouth really wide and stick out your tongue. Yeah, and then I'm going to lay this on your tongue and I'm going to check the back of your throat, okay? Okay, so if you'll gently open your mouth as wide as you can and stick out your tongue, okay? You ready? Okay. Okay, yeah, it's very irritated back there. And I can see that it's coming from your nasal congestion and it's going down your throat, into your throat. So yeah, you definitely have a very bad sinus problem. Probably getting close to being a severe sinus infection. Yeah, you can get them any time of the year, honestly. So, okay, you can shut your mouth now. Okay, so now that I have done that and I've checked it out and you are not feeling well, as I can see here, what I'm going to do is I'm going to take my gloves off and dispose of them. There we go. Now, what I'm going to do next is let me listen to your heart and your lungs first, okay? So I have my stethoscope. I'm going to put it on. Okay. And I'm going to warm it up for you. And I'm going to gently place this on your chest, and I'm going to listen to your heart, and I'm going to listen to your lungs. Okay, first I'm going to listen to your heart. Okay, it sounds very healthy and beating very well, so very good. Now I'm going to listen to your lungs, and when I listen to your lungs, I'm going to need for you to take a deep breath in, then release. A deep breath in, then release. Okay, I'm going to tell you when to do it. Okay, breathe in. Breathe out. Very good. Breathe in. Breathe out. Very good. One more time. Breathe in. Okay, breathe out. And if you don't mind, I'd like to go to your back here. Okay. Breathe in. Okay, very good. And breathe out. Breathe in. Okay, and breathe out. Okay. So that was really good. I'm going to take this off really quick. I'd like to also, if you don't mind, take a little peek at your ears. I think I like to take a little peek at them to see what they look like too, if you don't mind. You don't mind? Okay, great. So let me take this off. I'm going to wrap it back around here so it's not in the way and I can hear what you're saying. So I think I'm going to take my light again, if you don't mind. It's just a nice little light here, see? And I'm going to peek into your ears, okay? Okay. Okay, let me check this side. Okay. Okay. Okay, the ears don't look too bad. But, just make sure you take care of them. You know, don't stick a Q-tip in them, but clean the outside of the ears to help keep them very healthy and clean. Now, what I want to show you is I have this little pamphlet here. It has all kinds of different things on there that maybe one day we'll need to show you. But right now, we're going to focus right here. Here's the ear, the eyes, and we're going to focus on the nasal area right here. Throat, okay? So what I said like about the ear is what you would need to do is just clean the outside of the ears. Do not go inside the ears ever. That's not a safe thing to do. You would go outside. And the reason why I looked at your eyes is I wanted to look back in the back of your eyes to make sure I didn't see anything suspicious back behind there. Your eyes look good. They look healthy and very good. Then but we looked into your nose and we saw a lot of congestion and irritated, and what it does is it drains down into the throat area, and that is what's making you have a sore throat and not feeling well, because you have a runny nose. It goes here, it goes down, it can get into your chest. That's why I checked your chest. Everything sounds good. So right now it's just in this area we're having the runny nose, the coughing and sneezing. It's just a nice allergies, but we got to be careful that it does not become a very severe allergy infection. So do you have any questions about this chart? No? Do you have any questions about your allergies or anything? Oh, medication. Right now, what I'm thinking that is best for you would be some over-the-counter medications. And if for some reason they don't help, you could call the office and I can help you out. But right now I'd say stick with over-the-counter, you know, some allergy medicine, some nice cough drops, throat soothing cough drops and stuff like that, and it will help you a lot. So I'm going to write that down. And then I'm going to give you something because I see you have a runny nose here. So yes, over-the-counter. You could, if you have a little bit of pain, you could take a little bit of pain medicine. I don't think you'll need a lot. It's just the beginning in the allergy medicine. Now, if it does get worse, you call the office, and I will gladly write a prescription for something a little stronger for you. But I think we caught it at the very beginning of your sinus problem, that you should be just fine, okay? Okay. So I put that down there. What we'll do is we'll call it into your pharmacy, because I see that we have your pharmacy listed here, right? Yeah. So we'll do that. Now I'm going to tell you a couple other little things that you could do when you get home. Now, I am also going to give you this. I notice you're having a little bit of runny and sneezy nose, so I have a nice pack of tissues here for you. You're more than welcome to take these with you, and you can use them here now if you need them. So I'm going to give these to you. Here you go. Yes. Now, at home, you can go into the shower and you can take a nice, hot, steamy shower. Breathe in all that nice, warm steam. Inhale it and get it in there, and it will help relieve some of this also, okay? And if you keep having your headaches, you can put one of these, you put it in the freezer, you get it cold, or you could get it cool in the refrigerator, depends on how much you want it, and you will place it over your eyes like so when you're laying down, and it will help relieve some of the headache that you'll get from this sinus problem, because you do get sinus headaches and they're not nice at all. And if you don't like using these, you could take a cold wash rag or something like that and just lay it over your eyes and just relax. But being in the shower is really good too. Get all that steam, you know, breathe it all in and stuff like that, or even a nice hot bath would be great. Just make sure you make it steamy to where you get all that to help clear it out. I'm going to give you the tissues. You get your over-the-counter product and you use it, okay? But if you don't like using these are just nice and comfortable, and you just use them over your eyes. So, but if you need one of these, we do have some here in the office, and I can give you a spare one if you'd like to use this. This is just a sample one to show you. But you see it has all kind of little bubblies in here. Look at this. Look at that. Look at this. All these little bubblies in here. Isn't that so nice? So yeah. So if you want one like this, I'll be more than happy to give you one too. So I'm going to put this aside. So I give you all your instructions of what you're supposed to do, right? So you follow them, and if you have any problems, you call back here at the office, or you come back in, and I will definitely take good care of you. I have no prescriptions at this moment to give to you, but like I said, if things get a little worse, you let me know, and I'll take care of you and send a prescription to your pharmacy. Okay, so that will be the end of our visit. Did you have any questions for me? How long? You know, it's really hard to tell how long that it will affect you. Some people can get over sinus problems very quickly, and some people it could take some time. It just depends on how it is outside and how much the allergies are flaring up out there. You know, there's so many different kinds, so it's just really hard to tell. Yeah, but you'll feel better soon. And if you follow the instructions, you'll feel even better just by later on today. Just relax and relax and relax. When you get home, just take it easy and relax, okay? Okay. Well, thank you so much for coming in to see me. It is my pleasure to be here to take care of you, and I will always be here for you. So I'm just a phone call away, or you could come into the office and I will definitely squeeze you in. I try to take such very good care of all of my wonderful, wonderful patients. So I hope that you have a wonderful day and that you feel better soon. And if you need me, you just let me know, okay? Okay, bye-bye.